Well, hello, everyone. I'm Dr. Mary James with Women's Health Network. Thank you so much for joining me today. So a few months ago, I spoke with you mostly about lab testing, including how the most common single lab test, TSH, is ordered to evaluate thyroid function by itself and is often unreliable alone. And therefore, I recommended that you ask your doctor to also add in some extra thyroid markers, including thyroid antibodies. The reason being that autoimmune thyroid disease is the most common cause of hypothyroidism in developed countries. And I also suggested adding in actual direct markers of thyroid hormones, free T3 and free T4. The free part of that word referring to the fact that they're not bound up to binding proteins that keep them in storage, but rather they're the fraction that's free floating through the bloodstream and able to act on thyroid receptors and do all the work of thyroid. That'll give you a more complete picture, testing all of those markers. Well, today I'm going to talk about some of the most common causes of hypothyroidism and what you can do about it. As a reminder, you're probably already aware the thyroid makes T4, but then T4 has to be converted outside of the thyroid gland to T3. T3 is our most active hormone. It's the most available to the body. It does the vast majority of the work of thyroid hormone. Well, that conversion is just dandy if everything's in good shape. But unfortunately, there can be a lot of problems in that conversion. And another problem is that when you are low thyroid enough that your doctor gives you a prescription, it's almost always in the form of Synthroid or Levoxyl or the generic levothyroxine. Well, all of those are just T4. And they're giving that based on the idea that that T4 is going to get to T3 in the body. Most doctors believe this. The textbooks tell them that. It's in their guidelines. And in a healthy system, that happens. But there are a lot of problems that can interfere with that conversion of T4 to active T3. And that's what I'm going to talk about today. If we're making T4 or we're taking T4 and it can't get to T3, then it obviously gets hung up at T4 and we can't benefit from it. It's like being all dressed up and, with nowhere to go. So let's just go through a list of some of these factors. They're all reversible. That's the good news, except for one, as you'll find out, but the vast majority are reversible. So you can turn these around and not need thyroid hormone or be able to get off of thyroid hormone. Probably the number one factor that interferes with a T4 to T3 conversion is poor health. So if you have a chronic illness, whether it's autoimmune disease, chronic infection, diabetes, insulin resistance, chronic fatigue syndrome, fibromyalgia, really any chronic illness has the potential or is likely interfering with the production of active T3. So I really encourage you to get with your doctor or healthcare practitioner to work on any chronic illness to turn that around. And if you're already taking T4, you might chat with your doctor about also adding in some T3 or switching to a product that's a combination of T4 and T3 while you are working on these health problems. Another factor is crash dieting or severe calorie restriction. You've probably already heard that with crash dieting, our metabolism slows way down. That's because the body thinks we're starving. It doesn't know that we have food in the fridge that we're going to get to later, go back to. It really senses danger. And so it slows down metabolism, and it does that by reducing our production of T3 from T4. To the point, I've read that that once we go off of that crash diet, our metabolism is so slowed down that we actually require about 500 to 600 calories less per day to maintain our weight. If we go back to a regular diet, you might have found this yourself, that you wind up gaining weight, and it can take a long time for the body to kind of reestablish that norm and to essentially trust again. So there's a lot of reasons to avoid crash diets, but this is one of them. So ideally, lose weight naturally by sensibly focusing on healthy dietary changes, or dietary changes in the name of health, and the weight will usually naturally fall off, and it will be easier to stick to because you're just trying to get healthier. Inflammation is another big interfering factor in that conversion of T4 to T3. That can take many forms. You may be aware that you have inflammation because you have pain and redness and swelling. That's clearly inflammation, but there's a lot of low-grade inflammation that may not produce obvious symptoms that would make you think inflammation. So inflammation can be from chronic infections in the body, autoimmune disorders, eating an inflammatory diet, which would be the standard Western diet that is high in flour products and sugar and soft drinks and too many animal proteins, trans fats, processed foods, fried foods, all the things that the fast food joints sell. They all tend to increase low-grade inflammation in the body. You can also have inflammation from abdominal fat, and that's because fat that concentrates in the abdomen tends to churn out what are called inflammatory cytokines, the mediators or messengers of inflammation. Well, these cytokines will directly inhibit that conversion of T4 to T3. So get some help in resolving infections. They can often be hidden. For instance, Helicobacter pylori in the stomach or other gut bugs in the intestine. Lyme disease, periodontal infections, which can often be asymptomatic. You may not have any symptoms at all. Eat an anti-inflammatory diet. So move out those foods that I said cause inflammation, and instead emphasize lots of colorful fruits and vegetables. They are packed with compounds like antioxidants that fight inflammation, but they're also alkalinizing. I know Susan Brown has talked a lot about the alkaline diet and its benefits. So when we eat sugar, white flour products, and mostly a meat diet, then we tend to get acidic. And when we're acidic, that is directly correlated with inflammation. When we alkalinize, it does the opposite. All that inflammation just calms right down. Also in an anti-inflammatory diet, emphasize clean proteins, healthy fats, not the trans fats, not the fried foods, but olive oil, coconut oil, cold water fish are packed with the omega-3 fatty acids, or even consider an omega-3 supplement on the side. All of those are components of an anti-inflammatory diet. Also, under the heading of inflammation, eliminate reactive foods. So foods that, they may be outright allergens. You would usually know that if you have immediate reactions, often severe, anaphylaxis being the extreme, to foods that you take in. But there are a lot of food sensitivities, or immunogenic foods, that give us problems. And it's often delayed reactions that we have in terms of symptoms, so it's often hard to pinpoint them. If you already know that you are eating foods that make you feel worse in some way, I really encourage you to move those out of your diet. And if you're not sure what foods, if any, are giving you problems, then get with your healthcare practitioner to get some help with that. An elimination diet and reintroduction can help you usually pretty quickly identify foods that are increasing inflammation in your body every time you have an immune reaction to them. The T4 to T3 conversion requires some degree of cortisol, or adrenal stress hormone. So for that reason, cortisol insufficiency, not enough cortisol, which can happen with chronic stress, can then make you have low thyroid function. So how does that work? When we're chronically stressed, our HPA axis, the hypothalamic pituitary adrenal axis, hypothalamus and pituitary being in the brain, adrenals above the kidneys, it's the feedback system between the brain and the adrenals. And with chronic stress, those feedback signals can get disrupted to the point that we are not putting out enough cortisol when we need it. So now we're looking at low thyroid function on top of the adrenal dysfunction. So get serious about stress management. You've probably heard it ad nauseum, stress, 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 manage your stress, to the point that you're probably immune to it. We all are, I think, to some degree. But I think it's really important to remember that even if our minds get used to a frantic pace and think that we have to keep at that pace and maybe we can maintain it, our bodies actually never know how to adapt to it. They can't catch up, and we pay the price ultimately. So I really encourage you to get serious about managing your stress in your life, even if everybody else is running at top speed, and so it feels abnormal not to. It's very important. Get adequate sleep. Do whatever works for you to manage stress. Start taking really extra good care of yourself. Well, conversely, cortisol excess, too much cortisol, can interfere with that conversion of T4 to T3. That can be from acute emotional stress, but also remember that stress can be physiologic or physical. So then we get back to infections and inflammation, allergies, hypoglycemia, pain syndromes. Pain alone can cause cortisol to surge. The T4 to T3 conversion also requires a certain amount of insulin. Well, insulin gets released by the pancreas when we consume carbohydrates. Carbohydrates, I realize, are a bad word these days, just like fat used to be. But there are good carbs and bad carbs, and we're all different as well. Some people cannot handle an extremely low carbohydrate diet, and in some of those people, their insulin level actually goes so low that their thyroid function is affected. So just because, say, a high protein, very low carb diet is all the rage, if you feel bad on it, take that experience to heart and take care of yourself. Get some help looking into the kind of diet that you work best with. And it could be that taking in some amount of complex carbohydrates, very different from sugar and white flour products or any flour products, but complex carbohydrates like beans and legumes, some whole grains, they can help to keep your blood sugar stabilized and help with a little bit of insulin release. Conversely, too much sugar in your diet can interfere. So what's going on there? How would that interfere with the T4 to T3 conversion? Well, if we eat a bunch of sugar, then it pours into the bloodstream. We get a big spike in glucose, blood sugar, and that causes the pancreas often to overshoot with the insulin. So now we've got a big spike of insulin, and that causes the blood sugar that's there to just crash and bottom out. Well, one of cortisol's functions is to help raise blood sugar in the body. So if we've got all these wild roller coaster spikes in glucose and insulin, it's also very common for cortisol to overshoot. And now we're back to cortisol excess and interference with that production of active T3. Another factor is low selenium status. Well, that's because selenium is a cofactor for the enzyme that does that converting, takes T4 to active T3. If you've had a poor diet for a while, or especially if you've had GI problems, digestive absorption problems for a while, you might be low in selenium. You might actually be low in a number of minerals. I like to recommend to people that they take a multivitamin mineral, high quality formula along with their healthy diet, especially if you're working toward a healthy diet. And if you already know that you have Hashimoto's, if you've had your antibodies tested and they're positive, then I also recommend a selenium supplement at 200 micrograms a day. You can go too high, that's a very safe dose, but that there's some evidence that that helps the antibodies to come down. And of course, it helps that enzymatic conversion of T4 to T3. Another factor, iron deficiency anemia. So if fatigue is a big factor for you, if hair loss is also a big factor, it doesn't have to be iron deficient, but it's a common symptom of iron deficiency, also low thyroid function. But if fatigue and or hair loss are big problems, if you've had digestive problems, maybe low stomach acid, SIBO, small intestinal bacterial overgrowth, and especially if you've had a loss of blood over time, whether it's menstrual periods or some other condition that has caused some bleeding, I really recommend that you get that checked out. It's very easy to check your iron status. Certain medications can interfere with the production of available T3. So examples, beta blockers, especially propranolol. Beta blockers are given often for hypertension. Compounds called perfluorinated compounds, which just makes for those non-stick surfaces, like on Teflon pans or the linings of microwave popcorn bags. The compounds in cigarette smoke and smog, bisphenol A, BPA, phthalates, which can be in plastics, plastic containers, perfumes, a lot of personal care products, a lot of non-organic fatty foods, and then also toxic metals like mercury, lead, and cadmium. So it's impossible to avoid these days all of those chemicals, unfortunately, but there's a lot that we can control. For one, buy your produce organic. It's easy, I think, to kind of ignore that in the store, especially if the organic winds up being a little bit more expensive. But that's where most of the pesticides are in the non-organic produce. It's really essential that you buy your produce organic, that you only eat organic when you can. Chemical-free meats, wild-caught fish. Farmed fish might sound like they have lots of control over its quality, but farm fish is surprisingly toxic, so go for the wild-caught fish. Store your fatty foods in glass containers instead of plastic, especially foods that contain fat, because that tends to pull the chemical in more easily to the food. Cook in non-Teflon pans. Store your drinking water in glass water bottles instead of plastic. So there's a lot that we can do to live as cleanly as we can in this increasingly polluted environment we live in. And lastly, there can be genetic variation in the enzyme that converts T4 to T3, just like there's genetic variation in every other function of the body. We're all different. And that's why one protocol doesn't always work universally in everyone. There was a British study that looked at about 552 subjects with hypothyroidism. They were looking for this one particular mutation in the deiodinase enzyme, one of them, that converts T4 to T3. They found a whopping 16% of those people had a mutation that slowed down that conversion. And in those same people in that study, they gave, they'd been on T4, they gave them instead T4 plus T3, and they all did better with their symptoms. So that test is not commercially available as far as I know, but I bring this up to really just kind of drive home the reminder that we're all different. And so your doctor may be treating you according to standard of care and expect you to be able to respond like the textbooks promised you will. But if you're taking T4 and it's still not working for you, even at a higher dose, then talk to your doctor about the possibility, you could do it, look at it as a trial experiment, of adding in T4, either switching to a T4, T3 combination product, examples being Nature Thyroid, West Thyroid, Armor Thyroid, or if you've really got a big conversion problem, let's say some of these other factors that I talked about are really relevant for you, then it might be useful to actually take a compounded T3, a little bit more than you'd get in those other products. There's even time-release T3. It's probably a safer way to go. Lots of different options, but sometimes it's helpful to bypass that conversion step to make sure that you're getting the T3 that you need. So you can see there are a lot of different factors that can interfere with our ability to do what the body should be able to do, but doesn't always. A lot of things interfere, and now we get hung up at T4, we're not making enough T3. The good news is that other than the genetic variation, they're all reversible. So if any of them are relevant for you and you address them, you will likely experience a boost in your thyroid function. If you're already taking Synthroid or levothyroxine T4, but not getting benefit from it, again, it might be helpful to talk to your doctor about adding in some T3 as well and seeing how that does for you. And if you feel better from it, then that can be diagnostic in itself, that you are having problems taking your T4 and converting it to T3. And I think real importantly, the last point I want to make is that if you are taking prescription thyroid and some of these factors are relevant for you and you address them, keep in mind that your thyroid function is going to be improving along the way. And so you probably won't need as much thyroid, and maybe you won't even need prescription thyroid. So it's really important to monitor your thyroid markers with your healthcare practitioner along the way, no more often than every 2 to 3 weeks, because it takes time for the body to adjust. But monitor them along the way, and you may just be able to get off of your thyroid hormone completely. So that's what I wanted to talk about for today. Next time I will talk about another cause of thyroid hormone and what you can do about it. Let me see if there are some questions. Which part of the brain, left or right? I'm not sure what she's referring to. Which part of the brain? If you're talking about thyroid hormone, or I'm just going to make a guess here. If you're talking about the pituitary, or the hypothalamus, part of that signaling system, it's just right in the middle of the brain. It's not right brain or left brain. And if I probably misunderstood your question, so if you could clarify, I will be happy to answer on the site. Any particular brand of selenium? I think there are a lot of good brands out there, and I think selenium is probably one of the safer ones to go with a variety, choose from a variety of brands for. There's some thought that selenium methionine, the combination of selenium and methionine and amino acid, does better. So that's something that you might look for. And then just make sure there aren't a lot of fillers. I tend to not trust vitamins and minerals from just standard pharmacies because I think they're often, or Walmart kinds of places, there's probably some good ones there. I don't want to say they're all bad because I haven't really checked, but I think I would sooner trust any of them that are in a health food store. And any particular brand of multi, I would just say the same answer. One thing I'll say about a multi is that a lot of those one-a-days, you just take one little tablet, is either so packed in that it often has trouble breaking down in the body, or it's not big enough to contain ideal amounts of individual nutrients. So when I have looked at multivitamin minerals, I have been most impressed with encapsulated varieties that break down even if you're having some digestive problems, and also ones that have enough optimal nutrients in their formulation that it's impossible to take just get it all from one. So you'll often see a recommendation to take 4 a day or 6 a day, and if you divide those into 2 or 3 times, I think 2 is probably easier for most people to remember, take them with meals, there's actually a better chance that nutrients, supplementary nutrients, can get in that way if you kind of divvy them up over the course of the day. Lorena says, I had to beg for T3 from my endo. He said checking the antibodies is irrelevant, redundant. I think this is going to sound harsh, but I think a lot of doctors don't keep up with the research or even with physiology textbooks. So with all due respect, I think that that your doctor, that he's not considering aspects, things like I talked about today, and he's not being very open about the possibility of T4 maybe not doing the whole job. What are good food sources of selenium? Would it still be necessary to supplement? Probably the ones that you've heard about the most are Brazil nuts, and that's probably one of the most concentrated sources of selenium. If you take 1 or 2 Brazil nuts a day, you're probably getting what you need, but that's based on the idea that there's good nutritional quantity consistency between them, and the quantities are kind of all over the board. I still think that it's, I think if you're eating a good multivitamin mineral, you're going to get what you need, and if you're eating a healthy diet, you're going to be getting selenium that way too as well, and Brazil nuts are a great way to do it. A Mediterranean or a paleo kind of diet with a lot of vegetables, that's going to give you a lot of selenium. Let's see. I guess looks like that's it for now. Feel free to post questions after this, and I will keep checking back and respond online. Meanwhile, I thank you very much for joining me. I've really enjoyed it, and I hope you got something out of it too. I'll talk to you next time.